Hello everyone. I chose Marfan Syndrome for my best practice project for Gen Med. First of all, what is Marfan Syndrome? Marfan Syndrome is a genetic connective tissue disorder affecting the growth and development of your body throughout your life. It compromises the cardiovascular, ocular, and skeletal systems regularly for patients. And one out of 3,000 to 5,000 individuals are diagnosed with Marfan syndrome. And some of the physical characteristics that are easy to notice on a patient are long arms, and a tall, thin build, and maybe some overlapping teeth. So for the project, I did mostly diagnostics to diagnose patients with Marfan syndrome. The first one is to look at their physical characteristics. Then as you use the physical characteristics, you put those into the Nient nosology criteria, which helps guide the practitioner to figure out the root of if they have Marfan syndrome. Next, if you're pretty sure that they have Marfan syndrome, I would do an aortic screening to make sure there's no damage to the aorta. Next, I would check family history, and then I would go into a CT scan of the hips just to confirm your diagnosis. Nient nosology looks at all the physical characteristics of a patient with Marfan syndrome, uh, and and puts them into larger groups like the cardiovascular system or the skeletal system. For those to be checked off or to confirm that the patient has Marfan syndrome, you need two major flags and one systematic flag. And the mainly affected are the cardiovascular system, skeletal system, and ocular system. Next, I do aortic screening. For an average person with their diameter of their aorta is around 2.75 centimeters to 4 centimeters. Marfan syndrome speeds up the growth rate of the aorta, and it can grow up to 2 millimeters every year, which is abnormal for most. And after seeing a doctor, I would check regularly to make sure that there's no complications, or if your aorta gets to the size of 4.25 to 5 centimeters, which is a high risk for aortic complication. Next, for my management, I have them taking beta blockers to stop growth, going to a surgical procedure to put in artificial material for their aorta, and then just limiting their exercise. For beta blockers, they're generally used to keep blood pressure down and deal with hypertension. They are also used here for patients that their aorta is growing too fast. It subdues the growth. And if the medication was denied, the aorta will both grow and then their blood pressure will increase, which could cause a rupture in the aorta. And the aortic complication is the highest risk for death for a Marfan syndrome patient. And then for the exercise limitations, I want to put limited cardiovascular stress because of the aorta being too large and not be able to handle all the stress. Keep the heart rate below 100 beats per minute, and then also keep their aerobic capacity lower than 50%. And so keep it to leisurely activities like hiking, walking, or golf. References. Thank you.